Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Why aren't condoms as ubiquitous as they once were in the prevention of HIV and STIs? Today, Stephanie Desmond talks to Dr. Steve Goodrow, an HIV expert at the University of Washington, whose research shows that in the era of medications like PrEP, condom use is down among gay and bisexual men, and what public health can do to reverse the trend. Let's listen. Steve Goodrow, thanks so much for joining me.
Thank you very much for having me, Stephanie.
So today we're going to talk about condoms. They seem to be becoming an overlooked prevention tool for HIV and, of course, STIs, sexually transmitted diseases. What's the situation?
I would say the situation's complicated, right? And I would give, some context here, which is I'm a 51-year-old gay man. I've lived through most of the HIV epidemic, right? And for a long time, condoms was kind of all we had. And that's what gay men themselves were, supporting in each other and using. That's what public health was pushing. And then along came PrEP, which is a, medicine that people can take in order to prevent getting HIV. And then along came the awareness that anyone who is living with HIV and is virally suppressed, they can't transmit. So that was another great development. So we have these two amazing developments that came along in quick succession. So then the conversation shifted. Everyone was very excited about all those. And now it's been about 10 years since those came along. HIV rates have come down a bit. There's still many cases, but they've come down a bit. And so we've been in that new phase for a long time. And my research team and I thought, well, let's kind of take stock and look at, what's happening with queer men in terms of their PrEP usage and all of that. But also for those who aren't using PrEP, what's happening with condoms, right? So we went back and looked at a number of years of data, 6 years of data, from this great study done by my colleagues at Emory University. So shout out to Travis Sanchez and his team. So we were really looking at folks who were not using PrEP persistently for multiple years. We had 2 years of data from them. And what we saw was, especially among younger guys, 15 to 25, there was, a 7% change in how many were having anal intercourse without condoms. And among young Latino guys, it was almost 19% increase. And these, again, I'll just reiterate, these are guys who are not on PrEP. So that seems like it's a really big issue and something we should be thinking about and talking about.
And that's obviously something that is hard to hear from a public health perspective, where condom use used to be, as you said, the bread and butter of this.
Yeah. And I get why men were tired of talking about condoms. Public health was tired of talking about condoms, right? The study that looks at the usage is data that were collected. We don't have all of the full context around that. We can just see the pattern happening, right? But just being in this field and also being a gay man out in the world, I can also see that, those conversations are happening less and less. In this editorial that I wrote with two other colleagues, we sort of go through a lot of the arguments we hear from public health folks about why condom promotion is not the main priority. And I think, some of them are sort of the assumption that gay men themselves don't want to use condoms, so it's not our job to promote them. And I think that's true of some folks, but I don't think it's true of everyone. And I think it's easy to sort of make that slide from, okay, well, I have some patients or some people in my community who say they don't want to use condoms, so I'm just going to not promote them, when perhaps if there was more of that, there's folks in the middle who would be interested if it was happening more, if there were these conversations.
So has the increase in the use of PrEP had a parallel in the decrease of condom use, or is there sort of a disconnect there?
So we were looking at this timeline, 2014 to 2019, and we chose that timeline very specifically because that's basically the period during which PrEP rollout really took off in the US. And so we can say that the timeline of this was in parallel. Now, lots of folks will correctly mention that condom use was decreasing prior to the rollout of PrEP. So none of this is meant to say that PrEP is the cause of all of it. It's not. Condom use was already declining, right? People were tired of condoms after 30 years. So we can only sort of see the timeline, but lots of other people have already looked at what's going on with guys who are on PrEP, and condom use declines there. So that we know, and we can sort of look at the timing of that and see guys go on PrEP and then they reduce their condom use. And that's one thing. For this population of guys who are themselves not on PrEP, we can just say that this happens at the same time. But I think, again, being sort of out in the world and working with public health agencies at different levels, there was clearly a shift in emphasis in all materials and funding and everything towards PrEP. And it was basically around the same time when PrEP came out that you stopped seeing posters for condoms in bars, and all of the kind of apparatus around condom promotion just sort of decline. Is it completely gone? No, but it's certainly, I would say, lackluster a lot of the time.
So you mentioned that HIV rates in the US are falling, but I guess the concern here is that A, they're not falling as fast as they could, and B, that you also have other sexually transmitted infections beyond HIV.
Exactly. So I'm a mathematical modeler, and one of the things I've been involved with was projecting how fast would HIV incidence decline once PrEP rolled out, and we had sort of expectations around that, and it generally hasn't matched all of those models. So it's declined, but not enough. So, what else can we be doing, right? And one answer is more effort towards promoting PrEP and getting people, suppressed. And that's great. But the conversation is maybe also a bit more on condoms. So there's that piece. Even within the HIV world, right, I want to really drive home that we saw this huge distinction by age and then by Latino ethnicity in terms of how much this was happening, right? And at the same time that this was happening, you saw HIV incidence rates falling among white gay men, roughly stable among Black gay men, and actually increasing among Latino gay men. So I think there's the overall rates, there's also this disparity question. And then, of course, you bring up the very important point about all the other STIs, right? A few parts to that. One is the sense that, okay, well, if you're on PrEP, you have to get tested for STIs fairly frequently. So that kind of helps take care of that, because that will sort of nip those chains of transmission in the bud. We now have a new development, DoxyPEP, which is, a biomedical prevention for STIs. And then there's the reality that a lot of folks aren't as concerned about STIs as they are HIV. So you put all that together and people say, well, the STI side isn't that big a deal. But we've seen rates of STIs really increasing lately for many reasons. So I think it matters. We also saw Mpox come along, and it's a new STI and quickly became concentrated in the gay by male population. And, thankfully only 200 people died of it before it got under control, but it was another wake-up call, I think.
What can public health do? Yeah,
that's a great question. I think there's become, and I hinted at this before, but there's a sense of, well, queer men, they don't want to use condoms anymore, so it's really not our job to promote them. And so you don't see all of the kind of things you used to see. So there's a sense, well, preferences are set and it's not our job to change them. But I'll tell you, the most recent time I was in my neighborhood gay bar, and there's a condom bin in the corner, and that's wonderful that it's there. But I had to walk by 3 posters promoting PrEP. And one of them, I think, had, a handsome, young, attractive man on there, sort of all of the things that we know can shift people's ideas and preferences and, public health marketing. So we're still doing that for PrEP, but we're not doing it for condoms. It feels like there's a double standard there, right? That, preferences are set. We can't talk about condoms, but they're not set. We can, advertise other things. So I think just shifting that mindset and remembering we used to do this, and it's okay for us to do that sort of thing for condoms as well. We don't have to feel like we're stepping on toes. All of that vision of, returning to not just providing them in a dusty bin in the corner, but talking about how great they are, talking about what other advantages are. They have advantages. They have disadvantages too. So does PrEP. So just, honest conversations and materials and advertisements and all of that about the benefits and costs of condoms and all the others.
Now, I know you studied the United States in your research. What about around the world? Do you have a sense of what's going on elsewhere?
Yeah, that's a great question. And after our article came out and the New York Times article around it, I received an email from a researcher in Australia, Martin Holt, and his group has basically been looking at the same thing. They've had 2 papers come out very recently, so we didn't end up covering them in our paper. But basically, they're seeing a very similar pattern in Australia and similar in many of the details, right? And we were talking, should we, who do we know in Canada, in Europe, in New Zealand and Japan and other developing countries, perhaps even where PrEP has started, to do similar studies? And we haven't seen any. To me, this seems like such a major, important question, and yet not that many people are looking at it. So I would love to see similar research in other countries.
And in places like Africa?
Yeah, I think, part of the reason I didn't mention it there is there really hasn't been a lot of PrEP expansion for men who have sex with men, for gay and bisexual men in a lot of Africa, right? So I would say that is much more in its infancy in a lot of developing countries in general, and especially in Africa. So that's why I didn't mention it. And I'm very much focused and interested in this community of gay and bi men. And, there's different things going on with PrEP for heterosexuals and female sex workers in Africa.
So my last question, I guess, is what can be done? Bringing condoms back into the arsenal, as giving better press for condoms?
Yeah. That's one part. I think at every level. So you go up to the top, and we mentioned in there that if you go through the plans for some of the agencies, they don't even mention condoms, which seems really odd. And if you talk to those folks, they say, oh, but we do lots of condom promotion and we require all of our partners to do it. That's great. But if you don't even mention them in your strategic plan, that sends a message. I think partnering with, like we said, the businesses who make money off of gay men meeting and connecting, right? And that includes the bars, so bathhouses, sex clubs, all of that, sort of reinvigorating the strategies around condom promotion in them. We talk in our editorial about Grindr, which is, I think, by most measures or all measures, the biggest dating and hookup app for men. And in the app, they have a section called Health. And the options in your profile, and the options for health are HIV negative, HIV positive, using PrEP, virally suppressed. That's under Health. If you want to mention anything about condoms, it's in the tag section under kinks. So that sends a big message to me, right? It's there, but that's a huge message. And I'm not kink shaming anybody, right? But I don't see that as a kink. I see that as a part of health.
Yeah.
And the fact that they separate those so distinctly says a lot to me, right? I think there's just so many of these kind of missed opportunities that are happening at every level. And public health has a role to play in all of them.
Steve Goodrow, thanks so much for joining me.
Thank you so much for having me. This has been fun.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Ceciri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.